Hold up! Did you know your kidneys are more powerful than the latest smartphone, work harder than a 24/7 factory, and might just be hiding some mind-blowing secrets you never saw coming? Yet you might think kidneys are just boring little bean-shaped organs that filter your blood, but trust us, these tiny powerhouses are way weirder than you could ever imagine. For starters, they filter a mind-blowing 50 gallons of blood every single day. Yep, that's like running an entire swimming pool's worth of blood through your body every year. But that's just the beginning. Did you know that your kidneys can control your mood? Or that they have a secret connection to your bones, your brain, and even your sex drive? Yep, your kidneys might just be running the show more than you think. And here's the craziest part. Your kidneys are so sneaky that you could lose 75% of their function and never even notice. That's right. You could be walking around with only one functioning kidney right now and have no idea. Freaky, right? So buckle up, because in the next few minutes, we're diving deep into 10 of the weirdest kidney facts that will blow your mind and make you see these underrated organs in a whole new way. By the end of this video, you'll never look at your body the same way again. Are you ready? Let's go! Number 1. Your kidneys filter around 50 gallons of blood per day. Imagine your kidneys as the body's own high-tech filtration system, tirelessly processing an astonishing volume of blood daily. Each kidney houses about 1 million tiny filtering units called nephrons. Blood enters the kidneys through an artery called the renal artery, which branches into smaller arterioles that lead to the glomerulus. The glomerulus is a tangled knot of capillaries nestled within a part of your kidneys called the Bowman's capsule. Here, under high pressure, your blood is filtered, allowing water and small molecules to pass into the kidney tubules while retaining larger molecules like proteins and blood cells. This initial filtrate then journeys through the renal tubules, where essential substances are reabsorbed and waste is concentrated into urine. A study published in the Journal of Nuclear Medicine Technology in June 2013 delved into this remarkable process. Researchers employed radionuclide-based techniques to measure the glomerular filtration rate, which indicates how much blood the kidneys filter per minute. Their findings revealed that, on average, the kidneys filter approximately 120 milliliters per minute, totaling around 180 liters, about 47.5 gallons per day. This means your kidneys filter your entire blood volume multiple times daily, showcasing their efficiency and vital role in maintaining bodily balance. So, the next time you think about multitasking, remember your kidneys are the ultimate multitaskers, keeping you in tip-top shape around the clock. Number 2. You only need one kidney to survive. Believe it or not, your body is perfectly capable of thriving with just one kidney. When one kidney is removed or non-functional, the remaining kidney undergoes a remarkable process called compensatory hypertrophy. This means it grows larger and ramps up its filtering capacity to handle the workload typically shared by two kidneys. Essentially, your solo kidney becomes a super kidney, ensuring your body continues to filter blood, balance fluids, and remove waste effectively. A comprehensive study published in the Annals of Internal Medicine in 2018 sheds light on the long-term health of living kidney donors. Researchers from the University of Cambridge analyzed data from over 100,000 donors and compared them to more than 110,000 non-donors. They found that while there is a slight increase in the risk of kidney failure for donors, the overall incidence remains low. Specifically, the absolute risk increase was less than 1% over a span of 15 years. This indicates that individuals with a single kidney can lead healthy, normal lives with minimal additional risk. So whether you're born with one kidney, have donated one, or lost one due to injury or illness, your body is well equipped to adapt. Just remember to maintain a healthy lifestyle and have regular checkups to keep that lone kidney in top-notch condition. Number 3. Your kidneys help control your blood pressure. Your kidneys are like the body's secret agents, stealthily ensuring your blood pressure stays in check through a sophisticated process known as the renin-angiotensin-aldosterone system. Imagine this. Nestled within your kidneys are specialized cells called juxtaglomerular cells, constantly monitoring the pressure of blood flowing through. When they detect a dip in blood pressure, these vigilant cells release an enzyme called renin into the bloodstream. Renin then embarks on a mission, converting a liver-produced protein, 𝐬𝐮𝐻, into angiotensin-1. But the real magic happens when angiotensin-1 meets the angiotensin-converting enzyme, primarily in the lungs, transforming into the powerful angiotensin-2. This molecule doesn't mess around. It signals blood vessels to constrict, boosting blood pressure back to optimal levels. Additionally, angiotensin-2 prompts the adrenal glands to release aldosterone, a hormone that instructs the kidneys to retain sodium and water, increasing blood volume and, consequently, blood pressure. A fascinating study published in the Clinical Kidney Journal in December 2022 delved into this intricate mechanism. Researchers explored how various renal ion channels and transporters play pivotal roles in modulating blood pressure. By targeting these channels in experimental animal models, they identified several crucial physiological mechanisms and molecules involved in hypertension. This research underscores the kidney's central role in blood pressure regulation and opens avenues for potential therapeutic targets in treating hypertension. So the next time you think about blood pressure, remember the unsung heroes, your kidneys, working tirelessly behind the scenes to keep everything balanced. Number 4. Kidneys produce vitamin D. Your kidneys are like the body's backstage crew, playing a pivotal role in activating vitamin D, which is essential for bone health, immune function, and overall well-being. While our skin kickstarts vitamin D production using sunlight, it's the kidneys that perform the crucial final step to convert it into its active form. When ultraviolet B rays from the sun hit our skin, they transform 7-dehydrocholesterol into cholecalciferol, commonly known as vitamin D3. This newly formed vitamin D3 travels to the liver, where it's converted into 25-hydroxyvitamin D, also called calcidiol. This is the main form circulating in our blood and is often measured to assess vitamin D levels. The final and most crucial transformation occurs in the kidneys. Here, an enzyme converts calcidiol into 125-dehydroxyvitamin D, known as calcitriol, the active form of vitamin D. Calcitriol then goes on to regulate calcium and phosphate balance, ensuring our bones remain strong and our muscles function properly. A study published in the Kidney International Journal delves into the kidney's essential function in vitamin D metabolism. Researchers highlighted that the enzyme responsible for the crucial conversion to calcitriol is predominantly located in the proximal tubules of the kidneys. This localization underscores the kidney's central role in producing active vitamin D. The study also explored how conditions affecting the kidneys can lead to disruptions in this activation process, emphasizing the organ's importance in maintaining adequate calcitriol levels. Understanding the kidney's role in vitamin D activation sheds light on why individuals with kidney issues often face vitamin D deficiencies. Without proper kidney function, the body struggles to produce sufficient calcitriol, leading to imbalances that can affect bone density and overall health. This knowledge emphasizes the importance of monitoring and managing vitamin D levels, especially in those with compromised kidney function. In essence, while basking in the sun provides the raw material for vitamin D, it's your hardworking kidneys that ensure this vitamin is ready to keep your body in top shape. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 5. They influence your mood and brain function. Your kidneys and brain are like an old married couple, constantly communicating, influencing each other's moods, and when one isn't happy, the other feels it too. Beyond their well-known role in filtering blood, your kidneys engage in a complex dialogue with your brain, affecting everything from your thoughts to your emotions. Let's dive into this fascinating relationship and uncover how these two organs keep each other in check. At the heart of the kidney-brain connection lies the renin-angiotensin system. When your kidneys sense a drop in blood pressure, they release renin, producing angiotensin II. This potent molecule not only constricts blood vessels to raise blood pressure, but also crosses the blood-brain barrier, influencing areas of the brain responsible for mood and cognitive functions. Elevated levels of angiotensin I in the brain have been linked to increased anxiety and depressive behaviors, highlighting a direct pathway through which kidney function can sway your mental state. Imagine your kidneys as the body's natural filtration system, diligently removing waste and toxins. When they falter, as in chronic kidney disease, these unwanted substances accumulate, leading to a condition known as uremia. Uremic toxins don't just loiter in the bloodstream. They breach the blood-brain barrier, causing inflammation and oxidative stress in neural tissues. This toxic invasion can result in cognitive impairments, memory lapses, and even mood disorders like depression. It's as if the brain is operating in a fog, all because the kidneys aren't pulling their weight. Your kidneys produce erythropoietin, a hormone that stimulates red blood cell production. In chronic kidney disease, reduced erythropoietin levels can lead to anemia, characterized by decreased oxygen delivery to tissues, including the brain. This oxygen shortfall can manifest as fatigue, cognitive difficulties, and mood disturbances. Moreover, kidney dysfunction can disrupt the balance of other hormones and electrolytes, further influencing neurotransmitter activity and, consequently, your emotions and cognitive clarity. A study published in Frontiers in Neurology in 2022 delved into the impact of chronic kidney disease on brain structure and function. Researchers found that individuals with impaired kidney function exhibited smaller total brain volumes and increased white matter lesions. Specifically, there was a notable reduction in deep white matter volume and a higher prevalence of white matter hyperintensities, which are associated with cognitive decline and mood disorders. These findings underscore the tangible effects kidney health can have on the brain's architecture and operations. The relationship isn't one-sided. Neurodegenerative diseases like Alzheimer's and Parkinson's can impact kidney function. These conditions may affect brain regions that regulate the autonomic nervous system, which in turn can alter kidney operations. It's a complex feedback loop where the health of one organ directly influences the other, emphasizing the importance of holistic approaches to treatment and well-being. The interplay between your kidneys and brain is a testament to the body's intricate design. Maintaining kidney health isn't just about preventing physical ailments. It's also crucial for preserving mental clarity and emotional stability. So, the next time you're caring for your body, remember that a happy kidney contributes to a happy mind, and vice versa. Number 6. You could lose 75% of kidney function without symptoms. Imagine your kidneys as diligent custodians, tirelessly filtering waste and balancing fluids to keep your body in harmony. Remarkably, these resilient organs can endure significant damage, up to a 75% loss of function, without sounding any alarms. This silent resilience often leaves individuals unaware of the gradual decline, as the kidneys compensate for lost function until the damage becomes severe. Each kidney comprises approximately 1 million tiny filtering units called nephrons. When some nephrons are damaged, the remaining healthy ones adapt by working harder, a phenomenon known as hyperfiltration. This compensatory mechanism maintains overall kidney function, masking the decline. However, this increased workload can overburden the surviving nephrons, leading to further damage over time. A study highlighted in the American Journal of Physiology Renal Physiology emphasizes that elevated serum uric acid levels are an independent risk factor for kidney function decline, even in asymptomatic individuals. This suggests that managing uric acid levels could be crucial in slowing the progression of kidney disease. Given the kidney's ability to mask dysfunction, proactive monitoring is essential. Regular screenings, including estimated glomerular filtration rate assessments and urine tests for albumin, can detect early signs of impairment. Early intervention may involve lifestyle modifications, such as adopting a kidney-friendly diet, managing blood pressure, and controlling blood sugar levels. In some cases, medications may be prescribed to address underlying conditions contributing to kidney stress. While the prospect of a symptomatic kidney decline might seem daunting, knowledge is a powerful tool. Engaging in regular health checkups, staying informed about risk factors, and maintaining open communication with healthcare providers can make a significant difference. By taking these proactive steps, you can support your kidney's health and overall well-being. In summary, the kidney's remarkable capacity to compensate for damage allows them to function silently, even as impairment progresses. Number 7. Your kidneys recycle water. Your kidneys are like the body's natural water recycling plants, working tirelessly to ensure you maintain just the right balance of fluids. Every day, they filter an astonishing 180 liters of blood, yet only about 1% of this ends up as urine. So how did they pull off this impressive feat of water conservation? Each kidney houses around 1 million tiny nephrons. The nephron's journey begins at the glomerulus, a tangled knot of capillaries where blood is initially filtered. Here, water, along with various solutes, is pushed out of the blood and into the Bowman's capsule, marking the start of the filtrate's path. As the filtrate moves into the proximal convoluted tubule, a significant amount of water reabsorption occurs. Approximately 70% of the filtered water is reclaimed here. This process is closely tied to the reabsorption of sodium. Sodium ions are actively transported out of the filtrate and back into the bloodstream, and water, being the loyal companion it is, follows. This synchronized movement ensures that essential nutrients and a large volume of water are returned to your body early in the filtration process. Next up, the filtrate descends into the loop of Henle, which has a unique structure perfectly designed for water reabsorption. The descending limb of this loop is highly permeable to water, but not to solutes. As the filtrate journeys deeper into the kidney's medulla, the surrounding environment becomes increasingly salty. This saltiness draws water out of the filtrate and into the surrounding tissues through osmosis. In fact, an additional 20% of the filtered water is reabsorbed in this segment. The ascending limb, in contrast, is impermeable to water but actively transports sodium and chloride ions out, further contributing to the medulla's salty environment and setting the stage for more water reabsorption downstream. By the time the filtrate reaches the distal convoluted tubule, about 90% of the original water has been reabsorbed. However, your body's hydration status can vary, and this is where fine-tuning happens. The hormone vasopressin, also known as antidiuretic hormone, plays a pivotal role here. When you're dehydrated, antidiuretic hormone levels rise, signaling the cells in the distal convoluted tubule and collecting duct to insert water channels called aquaporins into their membranes. These channels allow more water to be reabsorbed back into the bloodstream, reducing urine volume and conserving water. Conversely, when you're well hydrated, antidiuretic hormone levels drop, fewer aquaporins are present, and less water is reabsorbed, leading to increased urine production. A study published in the Floaters Archive, European Journal of Physiology, in June 2022 delved deep into the mechanisms of renal water transport. Researchers highlighted that the proximal tubule reabsorbs about 70% of the filtered water, while the thin descending limb of the loop of Henle accounts for an additional 20%. This efficient reabsorption is crucial for maintaining body water balance, especially when considering that less than 1% of the filtered water is ultimately excreted as urine. The study emphasized the role of aquaporins, the specialized water channels, in facilitating this process. In essence, your kidneys are masterful conductors of a complex symphony, ensuring that water is precisely balanced to keep you hydrated without overloading your system. So, the next time you take a sip of water, give a nod to these remarkable organs working diligently behind the scenes. Number 8. They remove toxins in real time. Your kidneys are like the body's natural detox squad. working tirelessly to filter out unwanted substances and keep you in tip-top shape. As we explained earlier, each nephron contains a glomerulus and a tubule. Together, they perform the crucial task of cleansing your blood. Blood enters the kidneys through the renal arteries and flows into the glomeruli. Here, blood pressure forces water, ions, and small molecules like urea, creatinine, and toxins through the glomerular membrane into the Bowman's capsule, forming a filtrate. As the filtrate moves through the tubules, essential substances like glucose, amino acids, and certain ions are reabsorbed back into the bloodstream. This ensures that valuable nutrients aren't lost. Additional waste products and excess ions are secreted from the blood into the tubules, fine-tuning the body's chemical balance. The final filtrate, now called urine, collects in the renal pelvis, flows down the ureters, and is stored in the bladder until excretion. This meticulous process ensures that toxins and waste products are efficiently removed from the body in real time. A comprehensive review published in the Renal Replacement Therapy Journal delves into the kidney's role in eliminating uremic toxins, harmful substances that accumulate when kidney function declines. The study highlights that the kidney's filtration system is adept at removing small, water-soluble toxins. However, larger protein-bound toxins pose a greater challenge and are not as efficiently filtered out. This distinction underscores the importance of maintaining kidney health to ensure effective toxin removal. Did you know that your kidneys filter about 150 quarts of blood daily? That's enough to fill a standard bathtub. Of this, approximately 1.5 quarts are expelled as urine, with the rest reabsorbed into the bloodstream. This impressive feat showcases the kidney's efficiency in waste management. Number 9. Kidneys can regenerate. Your kidneys are remarkable organs, not only for their vital role in filtering blood and maintaining homeostasis, but also for their intrinsic ability to repair and regenerate after injury. This regenerative capacity, while not as pronounced as in organs like the liver, involves a complex interplay of cellular mechanisms and signaling pathways that work together to restore kidney function. When the kidneys sustain acute damage, such as from toxins or ischemia, the tubular epithelial cells within the nephrons are primarily affected. In response to injury, these tubular epithelial cells can undergo a process of dedifferentiation, where they revert to a more primitive, stem cell-like state. This dedifferentiation is marked by the re-expression of developmental genes and proteins, enabling the cells to proliferate and replace the damaged or dead cells. Once the repair is underway, these proliferating cells redifferentiate back into mature tubular epithelial cells, restoring the normal architecture and function of the nephron. Despite promising findings, several challenges remain in harnessing the full potential of kidney regeneration. One major hurdle is the limited regenerative capacity in cases of chronic kidney disease, where prolonged injury leads to fibrosis and scarring, impeding the natural repair processes. Additionally, while stem cell therapies offer potential, ensuring their safe and effective integration into damaged kidney tissue requires further research. Innovative approaches, such as tissue engineering and the development of bioactive scaffolds, are being explored to enhance kidney regeneration. For instance, researchers are investigating the use of biodegradable scaffolds incorporated with growth factors to provide structural support and promote the growth of new kidney tissue. These scaffolds can mimic the natural extracellular matrix, facilitating cell adhesion, proliferation, and differentiation. While still in the experimental stage, such strategies hold promises for advancing kidney regenerative therapies. Number 10. Your kidneys control your sex drive. Your kidneys, those unassuming, bean-shaped organs, play a surprisingly pivotal role in regulating your sex drive. Beyond their well-known duties of filtering blood and balancing fluids, they engage in a complex interplay with your body's hormonal orchestra, directly influencing sexual function and desire. At the heart of sexual desire and function are hormones like testosterone, estrogen, and progesterone. The kidneys contribute to the regulation of these hormones through several mechanisms. The kidneys filter out waste products and excess substances from the blood, including hormones and their metabolites. By maintaining optimal levels of these hormones, the kidneys help ensure that the body's endocrine environment supports healthy sexual function. Through the renin-angiotensin-aldosterone system, the kidneys help regulate blood pressure. Proper blood flow is essential for sexual arousal and function, making this regulatory role crucial. When kidney function declines, as seen in chronic kidney disease, this delicate hormonal balance can be disrupted. Studies have shown that individuals with chronic kidney disease often experience sexual dysfunction. For instance, research indicates that 70% to 84% of men with chronic kidney disease report some form of sexual dysfunction. In men, chronic kidney disease can lead to reduced testosterone levels, contributing to decreased libido and erectile dysfunction. Women with chronic kidney disease may experience menstrual irregularities, reduced estrogen levels, and decreased sexual desire. These disruptions are often due to the kidney's impaired ability to maintain hormonal equilibrium. A study published in the American Journal of Kidney Diseases explored the effects of kidney transplantation on sexual function. Researchers found that 85% to 90% of both male and female kidney transplant recipients reported significant improvements in libido post-transplantation. This enhancement in sexual desire was most pronounced in younger patients. Younger patients exhibited the most significant improvements in sexual function. Your kidneys are more than just waste-filtering organs. They're integral to maintaining the hormonal harmony that fuels your sex drive. Keeping your kidneys healthy supports not only overall well-being, but also a fulfilling sexual life. So show your kidneys some love. They're working behind the scenes to keep the passion alive. So these were the top 10 weird kidney facts you probably never or knew. Now we want to hear from you. Which of these facts surprised you the most? Do you know any other interesting facts yourself? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.